Now let's go to Zamfara State, where the government says it has earmarked over 2 billion naira in the 2026 budget to tackle malnutrition, especially among women and children. It says over 20,000 women benefited from a 50,000 naira cash transfer program it instituted against malnutrition. Nearly 4,000 others benefited from its 15,000 naira monthly stipend for 2 years. Theophilus Darofai reports. Malnutrition causes stunted growth, impaired cognitive development and weakened immune systems in children, while for women, it can lead to complications during pregnancy and a higher risk of mortality. Both can experience increased illness, fatigue and difficulty performing daily tasks. That's why the federal government, through the Office of the Senior Special Assistant to the President on Public Health, is collaborating with the Zamfara State government to tackle malnutrition through what it calls the Nutrition 774 initiative. Inaugurating the Zamfara State Council on Nutrition, Governor Lawal said his administration is investing huge sums of money to address malnutrition among women and children in the state.
The challenge of nutrition is one we understand intimately. It is not just a health crisis, rather it is an economic barrier and a profound threat to our human capital development. We cannot build a secure, resilient and prosperous Zamfara on a foundation of poor nutrition. And this is why Nutrition 774 initiative is not just timely, but absolutely essential.
20 to 25,000 women getting those cash transfers of over 50,000 naira. And then under the LIPW, under the CSDA, there are over 3,000 to 4,000 that have gotten 15,000 naira stipends for this 2 years. In the 2026 budget also, you have asked us to put in about 2 billion plus so that we will be able to fight this.
Ojuan Walker, the SSA to the President on Public Health, led the federal government's delegation to Zamfara State. They are poised towards strengthening collaboration on the implementation of the Nutrition 774 initiative, a key component of the federal government's efforts to combat malnutrition across the country.
It's something that is a continuous fight, but we want to speed up that fight of tackling the issue of malnutrition. But how do we do this? Is by working together. So we're hoping that we start to see results in the first quarter, second quarter of next year, and this takes an all of government, all of society approach.
The federal government's delegation also commended the giant strides of Governor Lawal in transforming the health sector and restoring the lost glory of Zamfara State. Well, that's about it on news from the state. Precious, we can see that the government at all levels, especially here in Zamfara, doing everything to ensure that they tackle malnutrition. But the question is, 15,000 naira monthly for 2 years, who gets what? How do they get it? And what are what is the data that was used, to reach out to these people? And is it sustainable?
First of all, it's not here in Zamfara, it's there. In Zamfara, this is Lagos. But I agree. First of all, when you look at the statistics, you realize that Nigeria has the second highest number of stunted children in the world. That's prevalence rate of 32%, for children under 5. That's a lot. And one of the major causes of malnutrition is also poverty. That's a major. And then you look at conflicts, access to food and all. So when you talk about poverty, I'm wondering what 15,000 naira can fix. Right. So
especially
as much as
with the inflationary pressures and all of that.
But maybe in areas where food is not a problem. For example, you grow food a lot in enough. Maybe for them, 15,000 can go a long way. Because sometimes we say maybe based on our own lifestyle. For somebody who actually needs the money, 15,000 can go a long way. Yeah. But that's the start, right? It's a start to ensure that children will reduce that number. And then maybe beyond that, policies, sustainable policies, where people can actually now feed themselves, will be what state governors, because I don't want to look at, we're always looking at the center.
That's right.
State governments should begin to look at how do we move from just handing out cash to actually empowering people in a way that they can feed themselves and not, because dependency is also a problem.
Absolutely. And if you look at Zamfara, Cross River, where the government announced that schools, especially students who had used certain textbooks, should not have that textbooks, with test materials in it, so that their younger ones will be able to use it. I don't know whether you had that experience, because I know that I used the books that my elder sister
Yes,
used.
and we didn't
used
used to write inside our textbooks.
Right.
The only textbook I think we ever wrote in was the handwriting one. I'm trying to remember the name now.
To train your handwriting.
To train your handwriting. But every other one, you never wrote in it because, of course, you get to pass it, and that's good. You do your homework in your book, not in your textbook. It also helps in the way that parents are not always thinking of how do I buy the same books.
That's right.
For the child who is now in primary 2 and the other one is moving to primary 3.
Yeah.
You know, I think that's a good policy.
And I think it's the era of private institutions who are capitalizing on parents who want the students to go to proper school, now monetizing so many things rather than ensuring that they are well educated over gains and all of that.
And that's a good one from the Zamfara state government, and I hope that other states would emulate.
Yeah.
That
Cross River
rather, because they're the ones with the education. I mean, we're getting a lot of education reforms these days on the news, and that's good.
That's right.
Ensure that let children write in their book. It's okay to buy my 40 leaves book. I think that's what we used to call it.
Yeah,
or the 80 leaves one.
Yeah.
But not, because the textbooks are more expensive. Imagine having to do that every term. And then for every child, every term.
And things are getting more expensive.
It's too much, yes.
Thank you, Precious.